Hi, my name is Jenifer Jones. I live in Brookings and I work remotely in the communications department for a Christian missions organization. I have a number of complex and severe digestive issues, and those are usually managed by a specialist out of state. But when my symptoms flare up, I find myself in the ER for pain management and hydration, and then just to run tests to make sure there aren't any additional issues that need to be addressed. Well, I'm really grateful because here in the ER, I've always been seen super quickly. I think my first experience in an ER was in a bigger city, and I just remember how awful that was to be sitting there in the crowded room full of people, and it takes forever, and you're miserable. So I am so grateful that every time I've gone to the ER in Brookings, one time it was just me in the waiting room, another time it was, just 2 or 3 other people. And so I've always been able to be seen really quickly, get back to a room really quickly, and start the diagnosis and treatment process really quickly. So I'm really thankful for that. My digestive issues are really painful. And it's hard to get that pain under control. And so usually I end up a couple nights in the hospital because we just can't get my pain under control. And so once I'm admitted into the ER, we kind of talk about, am I feeling ready to go home? Am I not? And usually the pain isn't under control enough for me to feel comfortable going home and being on oral meds. And so they admit me into inpatient so they can continue to give me the IV medication and fluid. And then we slowly work to the point where oral medications can work. And then, of course, also, do blood work and sometimes do a CT scan to make sure that there's nothing else happening that needs to be treated. Well, you all have a fabulous team here, wonderful nurses. I will say that one of the biggest things that keeps me comfortable here is y'all have beautiful facilities. I have stayed in a number of hospitals over the years, and I think your inpatient rooms are the best. I think they feel more like maybe staying in a nice hotel than a hospital room, and so much of being in the hospital is a mental battle, and when you can be in a beautiful space, then that just makes that mental battle so much easier. So just the rooms themselves are comfortable, and then very, very attentive nursing team. It's huge that my specialists at the University of Minnesota Health Fairview Hospital in Minneapolis and doctors here are able to work together, because I've been hospitalized a few times in Minneapolis as well, and whenever they're ready to release me, or whenever I'm feeling ready to be released, they've said, "Are you sure you're ready to go home? Like, you sure you're feeling stable enough?" And it's always been so comforting to me that I'm able to say, yeah, and if something changes, I've got a great hospital right at home, and I can just go to the ER and get, the testing that I need and the pain meds that I need and whatever else. And that's just been giving me such a peace of mind because, Minneapolis is rather far away, and I can't imagine having to drive all the way there when I'm feeling sick. So I've been so grateful for a great local hospital, and grateful that the two are able to work together to make sure that I'm getting the care that I need, and that all the problems are being checked out and taken care of the way they need to be taken care of. The rooms are marvelous. It was so nice to be able to be right here in Brookings, where my family is and my friends are. One thing that I love about the rooms is that the rooms are set up to be so visitor friendly. They're spacious. They have a lot of seating, and so multiple family members were able to come visit at once. Part of the couch pops up into a little table, so my nephews and niece and I played Go Fish, and we drew pictures, and that to me is the best medicine because, again, for me, it's such a mental battle. And so if I can be in a space that allows visitors to come and hang out and for them to be comfortable as well and for us to spend a lot of time together, that's just so essential to my care and mental health. I also appreciated that, the staff really tried to look at things from different angles. I've been visited by the nutritionist here, who is just a wonderful human, and she was really racking her brain to think of different options for my nutrition that we haven't thought of. I've been visited by the chaplain, and he was wonderful, and just being surrounded by wonderful people the whole time. Really, I think that nurses can make or break a hospital stay, and I was just happy with all of them. And so, I'm really, really grateful for all the people who make this such a great hospital. Yeah, my faith is really important to me, and so it was just nice to talk to someone who could, talk with me on that level, and he was just really encouraging, and it's so nice to know that people are praying for you and available if you need counseling or encouragement on that level. So I think that's a great resource that you guys have here. A good hospital is vital to any community, and I'm so thankful that we have such a nice one here that can offer so many tests right here and offer so many services right here. I've been so grateful, like I said, to be able to go into the ER and be seen relatively quickly. I've been so grateful that I don't have to drive to a different community to receive pain meds or fluids or testing or whatever it is. So Brookings Health System has, top-notch medical professionals, super duper caring nurses, a lot of great people, and the facility itself is really great. So I've been really happy with my care here, and I think other people would be too.
Are you one of Brookings Health System's grateful patients who would like to give back to us? Learn more about how you can give back at brookingshealth.org/mythanks.